Have you ever considered stopping operating after a complication has occurred or a couple of adverse outcomes from your surgery? I have. I was saddened to hear that a past younger colleague of mine had now stopped operating. I trained her when she was an ophthalmology trainee, and at the time she was a totally competent cataract surgeon. I don't know why she stopped. I can only presume that she had a bad experience with her surgery, or it may have been a couple of adverse, unexpected outcomes. For me, I stopped because I had a repetitive strain injury of my neck and I lost power in my left hand due to a cervical radiculopathy and nerve compression from disc protrusion. After a prolonged period of absence from surgery, 5 years, my injuries healed without surgery and I started back at surgery again. My first few months of lists went very well, and then I had 2 complications close together. The first one was an unexpected vitreous in the anterior chamber at the start of the case from an old injury, and a piece of nucleus fell down the back very quickly, and I had to refer the patient to a VR surgeon. Then, only a few weeks later, I had a suprachoroidal expulsive hemorrhage with a complicated combined surgery case, which I also referred to the same VR surgeon. And then I decided to stop surgery. I stayed with just consulting for a few months, but I missed surgery. The complications I had happened in private practice with no backup, really. I wanted to return to the public hospital and teach registrars, trainees in cataract surgery, and help them to manage complications well. And I wanted to be good at surgical repair of penetrating trauma. So I created cards about all the possible complications I could encounter, and I wrote out the instruments I would need for each scenario, and I also included on each card in detail the steps I would take to manage each complication well. I decided to tackle the problem head on and not keep running away from it. I had loved operating in the past. Well, my system worked. I returned to the public hospital, taught the registrars, became very experienced in managing complications, and became a competent surgeon repairing penetrating trauma. I was sad to hear of my colleague giving up surgery. And if any of you have felt this way or are feeling this way, just know you are not alone. Probably most surgeons have these thoughts during their career in surgery. And I'm telling you this to encourage you to come back to surgery if you have stopped, and to also encourage you not to stop if you haven't. I've transferred and I've expanded my handwritten cards on complications management to an online digital course covering IOLs, complex cases, management of complications, and also improving efficiency and safety in every step of cataract surgery. And it can help you to regain confidence and resilience. And the URL is on your screen and in the notes.